Friday morning, 1st of November, and you know what that means. The facial hair is going to come out in full force this month. The Movember movement. Dr. Michael Cox from the Vancouver Prostate Center. Welcome back to BT. Every year we have this important discussion, and here we go. You going to Mo this year?
Yeah, absolutely. We have over at the Vancouver Prostate Center, we have quite a big team going this year, so we hope to have our biggest year yet.
Yeah, the Walrus or the Handlebar? Which one are you going?
Well, I might even just go Fu Manchu.
Fu Manchu it.
Yeah.
You know, there's so much to talk about with Movember. Not only is the fun with the teams that are growing the most, but what's actually changed? And let's start things out and talk about the screening process of how this has evolved year after year.
So there's been a lot of changes in screening thoughts over the last 20 years. So we've seen from the time PSA was introduced in the early 90s, a decrease in mortality, and we now have a pretty stable incidence rate. So there is a lot of interest in understanding now more diagnosis. So we can certainly screen men, but the idea is to be able to distinguish those men who present with prostate cancer who really need to be treated versus those where an active surveillance or watchful waiting program might be more beneficial, because quite frankly, the impact of treatments is actually pretty severe as far as side effects are concerned. So we'd like to be able to keep men healthy as long as possible and really learn about which men are destined to progress and die of disease. Those are the guys we really want to intervene with, versus those guys who we know won't progress and die of disease. And so those are the guys we really don't want to treat. And so distinguishing those is the hardest part.
When we have our annual physicals, what's the target age for the guys going in that they should have the specific exam?
Okay, so guys that are in high risk groups, so men with a family history for sure, men of African descent, they seem to have the highest incidence of prostate cancer, so ideas are around 40 years old. But men in their 50s can start to be screened and start to monitor. And the understanding is that you want to be able to track these things. So an early PSA and a digital rectal exam are really good ideas because it gives your physician an idea of what your health status is, and then you can monitor changes over time, because that's really the most important part.
With this ailment of prostate cancer, how prevalent is it in Canada, and then looking at the numbers worldwide? Are we moving in the right direction?
So yeah, so prevalence is pretty constant. About 1 in 6 men will develop prostate cancer in their lifetime, and we don't diagnose all those guys. When a man is 80 years old, he has an 80% chance of having prostate cancer, but most men die with prostate cancer, not of prostate cancer. So that's a big distinction. So we're not changing incidence rates. What we are doing is we're changing survival. So we have had a 30% decrease in mortality since its introduction of PSA testing in the early 90s, and so it's been a very nice decline. So it is now, in Canada anyway, 3rd leading cause of mortality. It's still the most frequently diagnosed, but the 3rd leading cause of mortality has fallen below colorectal disease and mortality in Canada. And in BC, it is lower yet. So we've making good progress there.
With all of the money being raised, and for the people watching at home that are getting behind the Movember movement, where specifically does this money go, and how is it helping therapies and treatments move forward?
Okay, so Movember is raising money across Canada, in fact, across the world. Movember Canada's money goes into programs that they're very interested in. The first is to go into Prostate Cancer Canada, and those funds end up coming back as research grants to clinicians, to young scientists, to rising stars in early projects that are of supreme interest, and then into big programs. We have actually a large team grant that was funded a couple of months back here, a team grant that was funded by Movember Canada to our group led by Dr. Ralph Butchin. The other thing that they're really trying to do this year is become more global for men's health. So we're really interested in understanding where men's health is going, and what we'd like to be able to see is some efforts along those lines, psychology, those sorts of things. And so it's really interesting. There are 2 major foundations that are leading men's health initiatives in Canada. Both of them are chaired by the department head at the University of British Columbia's Urologic Sciences, Dr. Larry Goldenberg. And so he's really spearheaded this idea that men need to think about their health globally, not just one specific disease. We have to get men back into the healthcare system as they start to age, because between 15 or 20 and 40, who sees their doctor?
Well, Canada definitely leading the charge on this movement. A couple of websites we want to throw out there: prostatecenter.com and ca.movember.com. If you're getting behind the movement, we want to see these photos. We want you to have fun with it, but we also want you to raise the money, and obviously great work being done.
That's right. Make sure you raise money, folks.
All right. I can't wait to see the Fu Manchu at the end of the month.
Okay.
Nice one.
Thank you.
Always good seeing you.
Nice to see you too.